So we'll start off with the first question of the day.
Yeah. What I'll do is I'm going to take
The
some
facial
chocolates.
nerve supplies all of the following muscles except
Yes.
masseter.
Sir, this side. Yes, sir is coming. See, you can throw.
Alright. But which division of the inferior alveolar nerve?
Complete your answer, please.
Complete your answer, please.
Which division?
Which division? Second question. Damage to the facial nerve at the internal acoustic meatus would result in which of the following symptoms? Loss of hearing and taste from the anterior two-thirds of the tongue, dry eyes and dry
Raise
mouth,
of hand, raise of hand.
loss of facial muscles only,
Which one? A.
alright, correct.
Good.
See, this side, please raise your hand.
I know
Next
they're all
question.
coming up, yeah?
The facial nerve exits the skull through which foramen? Very simple.
Stylomeasure.
See, this is very important medically. So you have somebody have cut the lingual now. This caudate tympani has gone, and the patient has gone to the court and telling you that he or she doesn't have taste. How you prove that the patient has got a taste now? Every time you put something, they will say, I don't have a taste. Then how come you prove it? Very simple thing.
Yes, one person.
Very, very important this is. When you're doing impaction also. You cut the lingual, huh?
Please raise your hand. Sir, they want repeat of the question.
Repeat the question.
You have done impaction, leave caudate tympani on down. They done impaction, lingual nerve has gone for a toss, right? The patient is complaining of loss of taste, okay? But you are saying no, the nerve is okay. How you prove it?
Confirmation.
Something very sour or bitter.
नहीं, मैं तो बोलूँगा बहुत मुझे टेस्ट ही नहीं किसी चीज़ में. No. Think
Not subjective. He wants objective answer.
clinically. What happens if the nerve goes? What happens to your muscles? That yes, the papilla here, the papilla over the tongue denervates, is gone. The area will become slowly become depapillation. That's it.
So how you will prove it to the patient?
Tell the stick of tongue and take a picture of it.
Picture and show.
Yeah.
But how long will it take?
Several weeks.
Siddharth sir, the question is how much time it needs to get depapillate.
It is progressive. You have to fight with them in the court.
So which of the following nerves is a branch of facial nerve?
Raise of hand.
Okay. So next question. Which part of the brainstem contains the facial nerve nucleus?
I've run out of chocolates now. Oh, could be a disaster.
Alright. The next question is, which of the following facial nerve branches is responsible for closing the eye? It's A, B, C or D.
Oh, out of chocolates.
Yes?
Unanimous. All are on B.
Alright.
Everybody's eyes are closing.
Do we have enough chocolates?
No, we don't have.
Everybody's eyes are closing.
So question number 7, a patient with Bell's palsy would show which of the following signs? Loss of pain sensation in the face, paralysis of the entire half of the face. Yes?
Raise of hand, please raise of hand.
Raise your hands please.
Yes.
B it is. Question number 8.
I think everybody knows this one, don't they? If you don't, you shouldn't be sitting here, yeah?
Alright. So the next question is, which branch of the facial nerve is responsible for innervating the orbicularis oris muscle? Alright. The main blood supply of the face comes from which artery? Alright. I think, do we have more questions?
Yeah, most of them know everything now.
This was pretty simple for them, I think.
It was simple, but they've been listening
You know that,
basically,
yeah.
which is pretty good. Yeah, well done, guys. Well done, well done, well done.
So
Is
that's
there
why
any
ma'am
other
has announced
questions you've got
advance.
for any of us around carotid surgery, access to TM joint, facial nerve finding, looking after things, whatever, or anything like that at all? We haven't. Shrikantha, have you ever done a thing called an extracapsular dissection? I don't know, you might read this in your travels, an ECD, and it was popularised by Mark McGurk team from London, and it was to do with small pleomorphic salivary adenomas. Yeah, less than 2 centimetres, ones that were in the tail basically. Because what you didn't want to do was do a full parotidectomy or even a partial superficial parotidectomy. So his rationale was, and it was for pleomorphic adenoma, that there was like a capsule and a pseudo-capsule as long as you stayed outside that. So he done a thing called an extracapsular dissection basically. So your incision is essentially just a tiny preauricular incision with a little bit round the lobule there, careful not to give a pixie's ear as we talked about, bringing your skin flap forward and then basically doing an extracapsular dissection, spreading in the direction of the facial nerve, just in case the branches were quite superficial, and basically taking out the whole of the pleomorphic with a cuff, what they called a cuff of tissue around about it. And you can do an ECD in 20 minutes, half an hour basically, and that way you don't actually need to find the trunk of the facial nerve. You do this technique called an extracapsular dissection. I'm a bit sceptical about it. I've done a few. Small tumours must be diagnosed as a pleomorphic salivary adenoma. I got caught out doing one that my pathologist told me I needled it, and it was told it was a PSA. The damn thing turned out to be a mucoepidermoid, so I had to go back in again and take the whole of the parotid out and do a neck dissection at the same time as well. So just be mindful, but it is a technique. Extracapsular dissection, if you ever come across it, and the access is a lot smaller, it's essentially just a preauricular with a little hockey stick incision around it just to get to it. It's particularly good for lower pole lesions, a bit more difficult for lesions that are in the anterior part of it there, and God forbid it's in the accessory lobe, because sometimes you get an accessory parotid, which is they're the real nightmare to get to if you've got pathology there. So if you do read about that, it is a recognised technique, but it's got specific indications. I think that's us done here. We finished? Yeah, well, you told me to be 10 minutes, and we're 10 minutes, boss. Yeah.